we are going to see the fibrous skeleton of the heart. First, we will see the fibrous skeleton in a two-dimensional view, that's the older concept. Then we will see the skeleton, structure of the skeleton in the three-dimensional concept. Okay, so this is the two-dimensional view of the fibrous skeleton. So what is fibrous skeleton? It is a complex framework of dense collagen. That's the most important word. It's a dense collagen that forms four fibrous rings: 1, 2, 3, and 4. They form the four fibrous rings that surround the orifices of the valves. That means this fibrous ring surrounds the orifice of mitral valve. This fibrous ring surrounds the orifice of tricuspid. This one for aortic valve. This one for pulmonary valve. So that was about the four fibrous rings. In addition to that, it consists of a right and left fibrous trigone. That means this region will be known as the right fibrous trigone, and this left portion will be known as the left fibrous trigone. And also the fibrous skeleton includes the membranous parts of the interatrial and interventricular septum. So basically it consists of four fibrous rings, right and left fibrous trigone, and the membranous parts of interatrial and interventricular septum. So that was the introduction. Now just some basic points. The pulmonary ring, it lies in front and slightly to the left of the aortic ring. Both rings are set at right angles to each other and connected by a fibrous septum known as tendon of the infundibula, which is shown over here. Tendon of infundibula. Right and left atrioventricular rings, they are united by the condensed mass of fibrous tissue known as the trigonum fibrosum dextrum or right fibrous trigone. The left margin of the trigonum connects aortic and left atrioventricular ring. They are named as the trigonum fibrosum sinistrum or left fibrous trigone. These interconnected fibrous rings form the skeleton of the heart because they provide the attachment to the atrial and ventricular musculature. Also, they support the valves of the heart and give attachment to the aorta and pulmonary trunk. The fibrous skeleton disturbs the continuity between atrial and ventricular muscles because we can see very well that this is positioned between the atria and ventricle. So it creates a discontinuity between atrial and ventricular muscles. So for the propagation of the impulse from the atria to the ventricles, a specialized cardiac muscle, the conducting system, becomes absolutely essential, particularly in warm-blooded animals possessing higher metabolic rate. Simply put, the bundle of his will be piercing this region of the right fibrous trigone for the continuity of the conducting part. Recent three-dimensional survey of the skeleton of the heart suggests that four fibrous rings are arranged in four collagenous annuli which are not placed in the same plane. Earlier we have in the two-dimensional view we described the annulus in the same plane, but recently we have identified that in a three-dimensional aspect they are not present in the same plane. The Iotic Annulus, which is shown by this structure, Iotic Annulus occupies the central position and is closely interconnected to the mitral and tricuspid annuli. The Pulmonary Annulus lies further apart from the Iotic Annulus and is connected to the latter only by the tendon of the infundibula. All annuli form a deformable continuum. Before moving further, let's get oriented with what are the structures shown in this diagram. So this is the mitral annulus, tricuspid annulus, aortic annulus, pulmonary annulus. This is the anterior phyla coronaria of the mitral annulus. This is the posterior phyla coronaria of the mitral annulus. Similarly, this is the anterior phyla coronaria and posterior phyla coronaria of the tricuspid annulus. What is shown in this dotted line will be the weak sulcal connective tissue connecting between the two ends of the phyla coronaria. Next, this central region will be known as the right fibrous trigone, which is shown in black color over this region. Also, that lies almost in the center between the Iotic Annulus, Mitral Annulus and the Tricuspid Annulus. This black region is known as the left fibrous trigone, and it lies between the Iotic Annulus and the Mitral Annulus. Now this is the, as we mentioned earlier, tendon of infundibulum. This is the Iotic Annulus, this is the Pulmonary Annulus, and you can see the scallops over this region. One scallop, another scallop over this region, and one scallop will be present over the other side, which cannot be shown in this diagram. This is a better 3D view, three-dimensional view of the fibrous skeleton. In this view, this will be the tricuspid annulus, anterior phyla coronaria, posterior phyla coronaria of the tricuspid annulus, and the weak sulcal connective tissue. This is the mitral annulus. This is the anterior phyla coronaria, and this is the posterior phyla coronaria of the mitral annulus. This region will be the Iotic Annulus, and you can see the scallops over here. One scallop, another scallop over this region, and one scallop over this region. These are the three scallops of Iotic Annulus. Similarly, you can see the three scallops of the Pulmonary Annulus over this region. Now let's move on to identify the features of each annuli in this three-dimensional view. First one, the Iotic Annulus, this region. So the Iotic Annulus consists of three collagenous scallops. This is, I told you earlier, this is one scallop. The three scallops are anterior, posterior and right. Each scallop presents a concavity distally towards the ascending aorta, and this concavity provides attachment on its inner surface to the base of the aortic cusp of the aortic valve. You can remember aortic valve will be a semilunar valve, so the cusp will be attached on the concavity. Now the ascending limbs of the adjacent scallops, that is, for example, one over here, one over here. Ascending limbs of the adjacent scallops, they meet at the summit, which corresponds with the intercuspid commissures, which can be seen in the semilunar valves, aortic valves. The bottom of the posterior and left scallop, that is over this region, they form a fibrous body known as the left fibrous trigone, which is shown over this region, left fibrous trigone, which gives attachment to the anterior phyla coronaria of the mitral annulus. The bottom of the posterior and right scallop presents a well-defined right fibrous trigone over this region. This whole region will be the right fibrous trigone. The latter provides attachment to the posterior phylum coronarium of the, they give attachment to the posterior phylum coronaria of the mitral annulus and to both the phyla coronaria of the tricuspid annulus. Thus, the right fibrous trigone is sometimes called the central fibrous body, which is continuous ventrocaudally with the membranous part of the ventricular septum, that is over this region. It is continuous with ventrocaudally with the membranous part of the ventricular septum. From the right side of the central trigonal body, the tendon of Todaro extends subendocardially backwards, slightly above the opening of coronary sinus, to the left horn of the valve of the inferior vena cava. The bottom of the anterior scallop of the aortic annulus exhibits no collagenous thickening, but it provides the attachment of the tendon of the infundibulum, which you have shown in the previous diagram, which extends obliquely backwards and to the right from the posterior scallop of the pulmonary annulus. You can remember that. Now, the triangular intervals between the aortic scallops, that is this triangle, the triangular intervals between the aortic scallops are known as subaortic spans. And obviously you can see the cusp of the aortic valve will be attached over this region. So this subaortic spans will be forming the wall of the outflow part of the third left ventricle, that is aortic vestibule. Now that was all about the major points about the aortic annulus. One more point is the posterior aortic sinus bulges into the anterosuperior part of the septal wall of the right atrium as the torus aorticus. Just remember that. The complex part of the fibrous skeleton of the heart is majority over. Now we will move on to the other things. We will going to see the second annulus, that is the mitral annulus. It includes the left fibrous trigone, the right fibrous trigone, the phyla coronaria attached to the two trigones, and a weak sulcal connective tissue attached to the tips of the both phyla. Between the two fibrous trigones, the subaortic curtain forms a part of the mitral annulus. Next one is the tricuspid annulus, which forms the third annulus of the fibrous skeleton. It comprises of the anterior and posterior phyla coronaria, the right fibrous trigone or the central fibrous body where both phyla are attached, and a weak sulcal connective tissue which connects the tips of the two phyla. The tricuspid and the mitral annulus lie in the same plane, making an angle of about 45 degrees with the sagittal plane. But the mitral annulus is situated somewhat posterior-superior to the tricuspid annulus and a little inferior and to the left of the aortic annulus. You can appreciate the relation from this diagram. The fourth one and the last annulus of the fibrous trigone is the pulmonary annulus. So this region, which is not shown very clearly, but obviously you can see the scallops and the subaortic spans. The pulmonary annulus is set at right angles to the aortic annulus. You can very well see that. It is right, aortic annulus is directed over here and the pulmonary annulus is directed over this region. So it is set at right angles to the aortic annulus and is somewhat anterosuperior to the latter. The pulmonary annulus is triple scalloped. It is triple scalloped, similar to the aortic annulus, two in front and one behind. The inner aspect of which provides attachment to the bases of the pulmonary cusp. We have, this is the scallop, and inner aspect will provide the attachment to the base of the pulmonary cusp, similar to the aortic annulus. The subvalvular spans present between the two pulmonary scallops, they are continuous with the myocardium of the infundibulum, which is the outflow part of the right ventricle. The tip of the subvalvular span facing the aortic annulus gives attachment to the tendon of the infundibulum. So the tendon may undergo torsion and prevents the separation of both annuli during ventricular ejection. The clinical importance of fibrous skeleton of heart is in prosthesis operation of the heart valves. The fibrous skeleton is capable of holding sutures under persistent tension.